Hi there, this is Christopher Mitchell, and this is the Module 4 assignment for Pharmacology. The following video is a critical thinking study regarding a 54-year-old female who has been admitted into the emergency department where I work as a nurse. EMS personnel has given us information that the female was found wandering in a park, screaming obscenities, causing her to fall, and causing abrasions on her arms, face, and causing bleeding to her arms and face. The woman has been described as being disoriented, combative, and accusatory of the EMS personnel, even to the point of accusing them of stealing her purse. Upon admission into the hospital, I have noticed that the woman's hands are shaking severely, and she is shouting that she needs a bottle. The woman has dirty clothing on, and a smell of stale urine and body odor are coming from her body. Based on my assessment, the woman is suffering from severe alcoholic withdrawals from being a long-time alcoholic and is experiencing delirium tremens or DT due to her confusion, panic, and agitation symptoms. Long-term health risks that this woman may face is cirrhosis of the liver due to her suspected long-term alcohol use, causing the liver to not function like it should. Cirrhosis of the liver can lead to other complications such as blood clotting, decreased nutritional levels. Short-term health effects may include fever and seizures due to her delirium tremens, in which the woman must be closely monitored. The woman's shaking hands are indicative of advanced liver disease, which has caused hepatic encephalopathy, which would be the most severe assessment for the woman, as she needs to be closely monitored and tested for liver failure. She can be tested through liver failure through a blood test. The woman's confusion and combativeness are caused by delirium tremens, indicating that she is in a severe withdrawal stage of alcohol. The woman here in the emergency department has been a severe alcoholic for many years, and she is experiencing chronic and severe withdrawals from not drinking alcohol for several days. Assessments needed for this patient include testing her for liver failure or cirrhosis, monitoring her for any sort of chronic or severe pain, monitoring her for several days while she is detoxing from her alcohol withdrawals. This includes monitoring her blood pressure, her heart rate, her temperature, and her respirations. She could also be administered Librium or Valium to help with withdrawal symptoms. And being treated for the scrapes on her arms and face from her fall at the park must be done immediately to avoid any sort of complications with infection from the open wounds on her arms and face from her fall. Once detox, monitoring, and treatment are complete, this woman must seek out counseling, Alcoholics Anonymous support groups, and be prescribed with a medication called disulfiram, which reduces the risk of alcohol relapse and makes drinking very unfavorable, and actually kind of makes you sick when you drink while you're on this medication. Moving on to the research question, mental illness management includes pharmacological and therapeutic methods for treatment, such as mental health counseling and behavioral health counseling. Depending if a patient has health insurance, the mental health illness can be treated or managed. Researchers at the Milliman found that 45 to 63% of office visits were out of network regarding mental health care, making these costs extremely high for treatment. Mental health professionals are receiving low reimbursement rates, making them hesitant to contract with insurance companies. In many instances, behavioral health clinics and physicians are requiring out-of-pocket payment for services, making it difficult for the majority of patients to obtain the treatment that they need for their mental health issues due to financial barriers. If more behavioral health clinics would contract with insurance companies, and insurance companies would increase the reimbursement rates for mental health treatments, mental health treatment could become much more accessible for the majority of patients that are severely in need of behavioral and mental health treatment, obviously who have health insurance. According to Kimberly Leonard, 2015, untreated mental illness can lead to unemployment or homelessness, and people may turn to substance abuse or self-medication due to the lack of accessibility to actual professional treatment of mental illness, and can make the symptoms worse. Some turn to suicide and may end up in a prison instead of receiving the care that they need. There are many people in the United States who cannot receive treatment for their mental health conditions due to financial restrictions, leaving them vulnerable for much worsening symptoms and progression of their mental health disorders. All the resources used in this video I will attach to the link on the document page. Once again, this is Christopher Mitchell in Pharmacology. Thank you very much.